Hi, welcome to the Back to Basics series. In this episode, we'll discuss how to learn the direct chop technique, that is a vertical direct chop technique. Many beginners find it difficult to transition to the direct chop technique. I think the best way is to go step by step. I would recommend to transition to direct chop technique only after mastering the stop and chop technique. And one needs to master the direct chop maneuvers during the stop and chop technique itself. So let us go through one such case. This is a mature cataract with a grade 4 nucleus. The rhexis is done. And as the epinucleus is being removed, let me take you through some of the principles of the direct vertical chop. Most beginners find it difficult to transition simply because the coordination between the right hand and the left hand and the foot control is not still good enough. So that's the primary reason why most surgeons in their early part of the career find it daunting. So it's just a matter of time before the hand, eye and foot coordination gets in place. So predominantly the left hand maneuvers have to be under control. So let's see how it is to be done in this case. As we can see, I'm sculpting using continuous torsional power. The idea is obviously to go as deep as possible because this is a very dense cataract. Once I can see that I'm very much nearer the posterior plate and I'm attempting lateral separation using two instruments. The chopper on my left hand side and the Phaco handpiece on my right. Care is taken so that the lateral separation maneuvers are gentle. Instruments are need to be placed deep into the valley and then moved aside. Nucleus is rotated. The second half of the posterior plate which was attached is also separated. So now is our time to practice the vertical chop maneuvers. Now before actually I demonstrate it, let us practice this mentally. So in the vertical chop maneuver, we are going to bury the Phaco tip into the substance of the nucleus. The right hand, that is the dominant hand, is going to lift up the nucleus. That is the right hand is going to move up. Whereas simultaneously the left hand, which has the chopper, is placed just in front of the Phaco tip, buries the nucleus, goes down vertically and then laterally. So a combination of multiple maneuvers are happening. The best way to learn always is to divide these maneuvers into multiple smaller maneuvers. So let me go and demonstrate the first chop. The Phaco tip goes in, buries the superficial 1/3 of the nucleus. Then the right hand is pulled up. You can see the tip moving up. The left hand goes down vertically. Since it's a dense nucleus, we can't get a chop through and through chop in the first attempt itself. Progressively the chopper is placed deeper and the lateral separation maneuvers are continued until we see a full thickness crack. So let us try to examine this maneuver in slow motion. That is dividing one single maneuver into multiple small maneuvers. First thing, the tip goes in, occludes. We can see that the vacuum is raising and then the right hand pulls the nucleus gently, little bit up. The left hand with the chopper goes down vertically and then a lateral separation maneuver. Again goes down vertically and then a lateral separation maneuver. So essentially the maneuvers are a combination of the right hand moving up a little bit and the left hand moving down and then laterally. Moving on to the next fragment. The tip is buried in. The nucleus tip is then lifted up a little bit with the right hand. The left hand goes down vertically and then laterally. The nucleus is rotated to get the second heminucleus in position. Let us repeat these maneuvers in the second heminucleus. The tip is buried into the substance of the nucleus. The nucleus is pulled centripetally and then up a little bit. The chopper with the left hand goes down vertically, then laterally. The lateral maneuver has to be repeated a couple of times progressively in the deeper plane. I'm moving on to the last fragment. Again, the fragment is held and the vertical chop maneuver is repeated. One point to note here, which is slightly unnecessary, is the right hand is moving to the right side. It is not required. Sometimes we're at risk of going more towards the periphery when we try to move the right hand. So it's always better to avoid this maneuver and try to be centrally, and only the left hand should do the lateral separation. So now we have all the fragments which are separate. We have got around 6 fragments. Now is the time to emulsify them. So as the followers of this channel would be knowing, I prefer to use different settings for quadrant removal, especially in the machines which have got the torsional ultrasound, and because it gives better cutting efficiency. Important point to be mindful when you're doing quadrant emulsification is that the plane of emulsification has to be at the level of the pupillary plane or the rhexis margin, and we need to have adequate control with our foot pedal so that we don't have lens chatter and turbulence. Otherwise, the quadrant removal part of emulsification of nucleus is the easiest part in the nucleus management. The cortex is aspirated and the lens is implanted into the bag. To summarize, to transition to direct chop technique, I think one has to master the maneuvers of the left hand and the right hand and develop an appropriate coordination with the right hand, left hand and the foot coordination. And once we have this coordination adequate, that would be the right time to transition to the direct chop technique. In the subsequent episodes, I'll be demonstrating the direct chop techniques as well, so be tuned in. So the take-home message is you need to practice these maneuvers mentally. Divide the surgical step into multiple small steps, like in slow motion. Lift up the right hand, the left hand goes down vertically and laterally until we see a full thickness crack. So practicing these maneuvers in the mind before we actually do it on the nucleus will be great help. Hope you found this helpful. Thank you for watching.